Welcome, everybody, to the Everyday Health Hacker Podcast. I'm Mike Herzing, along with Eddie Valvaneda. I always mess up his name.
How are you guys?
He's Eddie V, the famous DJ.
Yeah, DJ, photographer, videographer, and I like to mess with Teresa and Trisha here at work.
Absolutely. And he's part of the staff here at Meridian Health Institute and Meridian Medical Dental. We talk about him every week, but finally we're going to actually ask him some questions because this guy knows it all right here. And he's going to tell us about it. So, all right, Ed, we were talking about, and we've talked about it off the air and things like that, about braces. You know, braces when I was a kid, it was brutal, horrible, nasty. You had to do it, but it was important. Mm-hmm. Okay, now recently my wife she snores and things like that, and so we realized that her teeth just aren't meeting right. So she was thinking braces, and you're like, no, you have Invisalign. This is so much better. Mm-hmm. So they come in, patients come in, they've got the problem. So the Dr. Folds will look at them and go, okay, let's look at this. Everything's not lining up. So first thing they did, they took a scan. And you're looking at this thing in the background. This is an actual scan of somebody's mouth.
Yes, it is.
Okay, now we're scanning this. What are we, people like, how do I know I need braces? How do I know this? My teeth are kind of, maybe they have gaps. Maybe I had a tooth pulled years ago or something. And so they're just not right. I know that my wife was talking about it. Sometimes she goes to bite and you really can't bite something in two. You go to chew and it just doesn't fit right. And you're going, I don't know what's wrong, but I know it's not right.
Yeah.
So what do you do? They come in and talk to you guys.
So when patients come in, Mike, and they're coming in for seeing, like, let's say they may start off with Dr. Liao or Dr. Folds. Mm-hmm. And some of them are coming in because, they may have, like, let's just say stress in their life, or they're clenching and they're grinding or things like that. They have all that. So a lot of it's with the bite. They have, maybe malocclusion. Let me turn this back.
Malocclusion.
Yes, so they have malocclusion. So when they come in, Dr. Liao or Dr. Folds will talk with the patient. We'll get them, we'll scan them with the iTero machine. This is what the machine is. And once we scan them, as you can see, here it displays, we call it the weather map. Okay. And so on this screen here, anywhere where there's red marks, that's indicating where you're biting the hardest. And so we want to eliminate that. And we can do that with the Invisalign. We can move the teeth, correct the bite to where you're not into malocclusion. That way you're not hitting so hard on these areas. Therefore, when you do that, well, it's taking a lot of that pressure away from the joints. And okay. It's, limiting, how much wear and all that you have. So that's one of the things that the scan does. And so once we submit this scan, then we submit it to Invisalign, and they make the trays, and then you come back in and you get your trays.
Well, I know that it's really kind of cool. Think of the days. I remember the days of of rubber bands and all these other things in somebody's mm-hmm. mouth, and they smile and they go, and they're so embarrassed. Mm-hmm. Invisalign, folks, you don't know what's there. This looks like this. Okay, just these little clear things, and they put little pieces on your teeth, and then they just pop in your mouth. And it's like they're not even there.
Yeah.
And you wear one of these for a couple of weeks, a pair of these, and then you'll go to a second pair, and then a third pair, and every couple of weeks you'll change.
Yeah. So depending on the patient, they may have, it can be a few trays, it can be 10 trays, it can be
They just call 20. They call these trays.
Yeah, your Invisalign trays. Okay. So I guess the question you were going to ask me what's the advantages mm-hmm. over with Invisalign over braces is that with Invisalign, you can take the trays in and out. Your oral hygiene, you can keep it a whole lot cleaner. You can clean the trays. You can floss, which bands and brackets, you can't do that.
you know, I never thought about that. Yeah. You're right. And also it just cuts the inside of your mouth open and things like that. These, you only really take these things out to eat.
Mm-hmm. Yes.
And I can tell you that it's real funny. My wife's been doing this for probably 4 or 5 months, and it's not long. It just you don't even notice it.
Yeah.
And it's, even if you grind your teeth, it's even better. I wear these type of things just for grinding my teeth and some of my tinnitus in mm-hmm. my ears. But you don't notice it. They don't hurt. They don't bother you. And all of a sudden you notice. All of a sudden your bite will start changing, and they'll maybe do another scan. You'll mm-hmm. go, wow, it's looking better. Mm-hmm. And some of these teeth here, you'll notice they're not really lined up perfect. but all of a sudden the gaps are gone in your
Yes.
teeth. Your face looks different.
Yes.
And in many cases, it's much better. I could use a lot. You know? Maybe I just do that for my face.
Yeah. Dr. Folds calls that, like a dental facelift.
That
Because,
dental
when
facelift.
you're moving the roots and things like that, it's,
Right.
You're expanding the arch, and it'll just start to lift the, cheekbones and like that. So you're doing like a facelift where you don't have to actually go and do like real surgery. you
Yeah,
know?
but also don't forget that you can also help your snoring.
Yes.
It helps your sleep because you're not grinding your
Mm-hmm.
teeth as much. You can actually eat your food a lot better. And like I said, the only time you take these out is to brush your teeth and maybe floss
Yeah.
and eat. And then
Yeah.
they pop right back in.
And Dr. Folds is really big on splint therapy. And so he's a reconstructive dentist. And so a lot of the patients, they wear their splints and to prevent all that grinding. So when you wear your Invisalign trays, I look at it like this.
Okay, there's a tray and a splint.
Yes.
2 words.
Yeah. So the way I look at it is the splint, let's just say, you may get some, I'll throw a number out there. If a patient came in and they're like, oh, my jaw's hurt, and I get headaches and things like that. We can put you in a splint, and let's just say,
Which is just one of these.
yeah. Well, we can do a top and a bottom, but it doesn't.
These are called not only trays,
Yeah.
but if they don't really change in anything, they're not moving anything.
Yeah, they're not
just
moving
a
nothing,
splint.
just a splint. Yes.
Okay.
So we can get you some relief to feel better, but I feel
Yeah, it
like
works.
if you are a patient that's going to be committed to wearing a tray, a splint that's not moving teeth for top and bottom, why don't you invest in wearing something that will move your teeth? That way, when you put your teeth in the correct alignment, everything's in harmony. And so by doing that, I feel like you're going to get a greater end result, because now that your teeth are in the proper alignment, it's going to cause those muscles and everything to relax more if a patient versus a patient just wearing, a splint.
Yeah.
And so like
There's
I said-
mine.
Yeah, there goes your splint.
I just
Yeah.
dug it out. I normally would pop it in and just like this, folks. And this is what
There
you
it
wear.
goes.
Same
Yeah.
thing all day. You don't even notice it.
Yeah.
It doesn't necessarily see it.
Yeah. And you're talking normal.
Well, I never talk normal, but we're getting close. It's closer, but you get to the point that you don't even know it's there.
Yeah.
And it's really kind of cool.
Yeah.
And your tongue has more room. It's real funny. Some people will sleep and they just make these terrible snoring sounds, and you wake up choking, and it's because your mouth has changed. The doctor told me this, and there's no room for your tongue to lay. And
Yeah.
so they'll change the roof of your. It's just funny that these funky little pieces of plastic can
a lot.
change your life
Yeah.
so much,
Yeah.
and they just pop in. These are held in by little things they glue on your teeth to hold it.
Yeah.
Versus these are the trays, the splints just pop in and out. They don't have anything to hold them.
And when you come in to get the attachments, it's a painless procedure. It's nothing. You will need about an hour, and patient will come in, and what we do is we'll give the patients their tray first to kind of get the teeth a little loose in the socket, because they're tight. I mean, they're made to move teeth. And by doing that, it gets the teeth in the bone just a little loose. So we have them come back a week after with the same tray, and we'll place the attachments. And like I said, it's a painless procedure. We just bond these little attachments to the teeth, and we deliver your trays, and then they stay on there the whole
Just
time.
a bracket, little
But
alignment.
yeah, it's just a little
teeny tiny
call them
alignment.
buttons, attachments.
Yeah.
People say dots. Everyone, people have a name for them, but we just bond them on there, and we don't change them out with every tray. They just stay on there the whole
time.
duration of the
And then
treatment.
and then when they're through with the program, which takes 6 or 8 months,
yeah, just depending on
how bad it is.
Yes.
And then they just pop them off, and you're done. And then
Yeah.
you may want to wear a splint, like I do,
Yeah.
forever.
Yes.
And just it'll keep me, because I grind my teeth. Oh my gosh! And I have tinnitus, which is the ringing of the ears, and that has to do with the joint right here. Kind of goes into your ear canal. So when you start having that problem, guys, if you leave it and just ignore it like I did, and I didn't really know, the ear, nose, and throat guys go, "Oh, we can't do anything." Well, Dr. Folds is working on it, and it's making it better. So, folks, if you suffer from tinnitus or something like that, gosh, don't suffer. Come see these folks. They do a great job.
We love to get you scanned. We love to get you in Invisalign. If you're one of those individuals that are suffering from, like Mr. Mike said, the tinnitus, TMJ, and things like that. So Invisalign definitely helps a lot, and not only would it help with those issues as well, but if patients do suffer from malocclusion, since the teeth
explain it to real people what malocclusion is.
Malocclusion is basically when your teeth are they're not in alignment. They're crooked. They're all over the place. So
not everybody's perfect.
Yeah, and so when that's the case, when your teeth aren't in that proper alignment, over time, if you're a person that doesn't see your hygienist on a regular basis, well, you'll start to get plaque buildup, tartar buildup in those areas. Well, when that happens, then it eats away at the gum, eats away at the bone, and then you start getting like gum disease, and that same plaque, you can find it, on your arteries, your heart, so then people can start getting sick from that, But when we start putting the teeth back into their proper alignment, well, that will help, eliminate a lot of that gum disease and tartar and plaque buildup too as well.
Cool. But also, when you come in for, I know this is kind of getting off subject, but when you come in for a cleaning, that really just brushing your teeth every day, I don't care how good you are, that really does not enough, is it?
No, you have to floss too.
Okay. I always floss. Right before I come in and see the dentist, I always floss. When's the last time you flossed? Oh, yesterday, because I'm coming in today. No. Yeah. I do floss occasionally, but not as much as I probably should. I don't know of anybody that does.
Yeah, it's good. It's good to
floss.
It's good to floss,
but handy. But it's important, guys. And all this nasty stuff is in your mouth. I mean, people think your mouth is all that clean. It's really not. It's one of the nastier places on your body.
It is.
There's other places on your body that you think are nasty. Okay, your mouth is nastier than that. And that's not good.
Yeah.
So you really need to take care of this, and it's not bad. It's comfortable. It's not. My wife has had no problem with it. I have these splints. It's no problem at all. It's really done nothing but help, and keep me from grinding my teeth down to nothing. And so they've got these cool machines. They've got all the stuff. It's painless. It's not horribly expensive, and they have all kinds of payment things like that. But I tell you, it's really, honestly worth it. So don't put it off. Try to do it. I put it off for a long time. I really wish I hadn't. I put it off because I didn't know it was available.
Yeah.
And that's the cool for all these people that are younger than me, which is everybody. This is all available, and it's just really cool. Don't suffer.
There's no age limit on Invisalign. We have older patients, well in their 80s.
I'm not quite there yet, but I may look it. But
no, not you, Mike. No, but we have teens, young adults that are kids, teenagers, young adults. So there's no age limit to Invisalign. Anybody is a candidate for Invisalign. So it's a great product. It's good. We stand by it 100%. So we love Invisalign.
Yeah. So really, folks, don't panic about it. Don't worry about it. If you have any questions, you can always get hold of the folks, info@everydayhealthhacker.com. You can call over here, 281-265-6565, and talk to any of the folks here at Meridian Medical Dental or Meridian Health Institute. You can even talk to the dog who's barking
Denali,
right now.
Yeah. Come see Dr. Denali.
She is barking right now. Probably lunchtime for her. There we go.
Or she might be waiting to see a patient.
Might be waiting to see a patient. Yeah. So get a dog biscuit. But either way, she probably has Invisalign. But don't put it off. Don't do it. If you have any questions, just check with them. You need to know pricing. This, that. If you even need it, come by. They'll do this machine and go, hey, it's not that big a deal. Or we can knock it out pretty quick, or you're going to need a whole bunch of trays.
And it doesn't take long to get the trays back either. We can if you came in and get you scanned, about a week and a half or so, the trays are here.
And they'll start working. You'll be able to talk better. You'll be able to listen to better. You'll sleep better. I can't say you can jump tall buildings or,
I can't, Mike.
You can, but he can probably jump. But if you need anything, talk to Ed. Eddie Valvaneda. You can talk to Adriana. You can talk to anybody here. They're all awesome. Meridian Medical Dental, Meridian Health Institute, right here in Sugar Land, Texas. Be glad to help you. Always info@everydayhealthhacker.com. As far as the great staff, everybody here, we'd love to talk to you. We'd love to hear from you. Like I said, just give us a yell, and by all means, check out some more of the videos. They're really awesome. We like it. We like doing them.
All right.
Ed, thanks for joining us today.
Yes, sir. All right.
Now get back to work.
All right. Everyone have a good day.